In this video, we will try and learn how to teach toilet training to a child who has autism or neurodevelopmental disorder. Now, you all will agree, toilet training is an extremely important skill, more so if the child is growing up. Toilet accidents lead to shame and embarrassment in the child. They lead to negative emotions in the parents too, like anger and frustration. Children who have toilet accidents are generally not accepted by their peers. They may also find admission in schools difficult, as most preschool insist on the child being toilet trained first. Also importantly, every time cleaning and dressing the child after each toilet accident takes up a significant time and energy from his therapy. To make matters worse, the usual intervention for toilet training do not seem to work for autism and neurodevelopmental disorders. But there is a silver lining. Almost every child can be toilet trained. It does take a great amount of effort on the part of the parent and the child both, but it is definitely worth it. Now, before you start toilet training your child, you must analyze whether you are ready. Completely toilet training the child may take weeks to months, so you must have adequate time in hand. You must be fully committed to the program so that you can teach toilet training to the child throughout the day. So please do not start the toilet training program if you are too busy or you have some major event coming up or you are expecting a significant disturbance in your routine, like the birth of a child or family members visiting you or sickness of the other parent. That is not the right time to start toilet training. Also, another important thing to note is do not rush into toilet training program. If the child has been recently diagnosed with autism, the first priority is to get the therapy team and the support system together. In the initial few weeks, working on language skills takes priority over teaching the child toileting skills. One thing is very obvious, you cannot be doing everything on your own. You require help. So you must have a team. This team can comprise of your partner, other family members, elder children in the house, or teachers at school. One important point to note is that all the team members must be on the same page. Consistency in the training method among the teachers is extremely important for the child to learn toilet training. All the teachers in the team should use same word while describing urination or bowel movements. They should be using the same strong reinforcers. They should be documenting all the successes and the failures during the training program in a similar manner. Only if all these things are in place, it means you as a parent or a caregiver are ready to teach toilet training to the child. Now to check whether the child is ready for toilet training. The child should be having regular bowel movements. That is, the child should not have constipation. Also, the child should realize or notice whenever their diaper is wet or soiled. It will be helpful if the child can also indicate to their parents whenever they soil or wet their diapers. Also, it is a helpful or a good sign if your child moves away from you or hides from you when they have to go for bowel movements. Before you get down to actual toilet training, you need to do some preparation regarding the environment and the child. Choose correct words to describe the urination and the bowel movements. You must take into account the developmental age of the child. If the child has difficulty with language, please avoid using difficult words. You should use the simplest words. For example, when you are initially starting the training, you may use words like pee pee or poo poo to describe urination and bowel movements. Later on, as the child's language improves, you may start using more age appropriate words like bathroom or washroom or potty, but that comes later. Make a list of strong reinforcers for the child. The toilet training may be discomforting for certain children. Hence, you will require strong reinforcers. Now, a reinforcer should be something which is completely under your control. The child should not have access to it unless you give it to the child. This reinforcer has to be highly motivating for the child, and it should be given to the child immediately. Don't have abstract concepts or things that reinforces. Like, do not promise the child, if you go to the potty today, I will take you for dinner tomorrow. Such vague, long-term, abstract reinforcers do not work, especially when you are just starting the therapy. Typically, for small children, the best reinforcers are food items, juices, cartoons, songs, stickers, etc. Once you have made a list of strong reinforcers, and remember, this list of reinforcers is decided by the child, not by you. If the child cannot communicate, you have to observe the child over a period of time and understand what motivates the child the most. For example, a reinforcer for a child may be a toffee. For the other child who does not like eating sweet things at all, for this child the reinforcer may be jumping on a trampoline. So, do not have a general idea of reinforcers in your mind. It is highly individualized for children. So now once you have made a list of reinforcers, start pairing the bathroom and the commode or the potty with the reinforcement. The child should associate going to the bathroom and sitting on the potty with pleasurable things. Only then will he do it willingly the next time. Make the environment easy for the child to navigate. What I mean is that the process of going to the bathroom should not be arduous for the child. So if the bathroom door is locked at every time and the child has to struggle with opening the lock, it defeats the purpose. So when you are toilet training the child, keep the bathroom door open at all times. Also, the potty or the commode seat should be down. If the child is small, then there should be a potty ring on the commode. Also, a small child should be given a stool on which he can place his feet. Otherwise, if his feet are dangling on the time, it will be very discomforting for him and he may not sit for long. In addition to this, entire other things in the bathroom should also be prepared. For example, there should be a tissue or a jet nozzle for the child to clean himself. There should be a towel, there should be a soap, which is easy for the child to use. So what we are teaching the child is not toilet skills in isolation, but the entire process of going to the washroom. In the initial few weeks, you will be required to prompt the child multiple times. By prompt, I mean is you may be required to actively assist the child. Initially, the prompts may be full physical prompt where you may need to lift the child or touch the child to make him complete the entire process, like sitting on the commode, getting up, washing himself, washing his hand and feet using the towel. But gradually try and fade out these prompts or reduce the dependency on these full physical prompts by gradually fading it to occasional physical prompts, and then to verbal prompts, and then to gestural prompts, and finally no prompts at all. Final preparation for toilet training is to document whether your child has a pattern for urination or bowel movements. Generally, small children follow a pattern, like they defecate or urinate after getting up from sleep or few minutes after having their meals. If you can find such a pattern for your child, it will make further toilet training a little easier. Let's start with daytime bladder training, as the daytime bladder training is likely to be easier than nighttime bladder training or the bowel training. It is best if the child is not made to wear a diaper when you start daytime toilet training, because if the child is wearing a diaper, it may be difficult for the child and for you to know when the child has passed urine or stool in his diapers. Ideally, the child should just be wearing his underwear or underpants. And also ideally, the child and you should be at home when you begin toilet training, so that the child has the opportunity to wear underpants throughout the day. But if for some reason the child has to wear pants while at home, make sure that he wears the pants over his underwear and the pants have a elastic or a velcro waistband, which is easier to remove in case of accidents. If during this training period the child has to go out of the house, like to a restaurant or a movie hall or to school, then remember that the child should wear a diaper over their underwear. I'll repeat. In such case, the child should wear a diaper over their underwear so that they still feel wet when they urinate. Now, of course, the child will continue to wear diaper when he's going to sleep, because that level of bowel control or bladder control comes much later. But make sure that the child wears the diaper only when he or she is already drowsy and about to sleep, so that they don't have an opportunity to wet their pants or diapers when they are awake. Also, the first thing that you must do is when they get up in the morning, remove the diaper and take the child and make the child sit on the potty, because this is the time he is most likely to pass urine or have a bowel movement. As I have said earlier, our goal is to teach the child the entire process of visiting the bathroom. So now that you have made the child sit on the potty for 5 minutes or so, don't wait longer than that. 5 minutes is adequate time to have a bowel movement or to pass urine. After that, even if the child did not pass urine or have a bowel movement, you still make the child undergo the entire drill of cleaning himself, pulling up his pants, washing his hands and drying his hands. The child may require your prompt to do so, so kindly help him out. One important point to remember is that even when you are teaching daytime bladder training to a boy, this boy must be taught to pass urine while sitting down in the potty, because it is not uncommon to have a bowel motion when the child is urinating, which is obviously will be very messy and difficult for the child. Once the boy has mastered passing urine in sitting position, then he can be transitioned to passing urine while standing up. What we must remember is that we have to provide the child maximum opportunities throughout the day of visiting the bathroom and sitting on the potty to pass urine. One easy way of achieving this is to give the child lots of liquid to drink throughout the day, and also to give him salty foods which will increase his thirst, and hence he will drink more water or juices. All this will increase the possibility of him passing urine in daytime. Also, a toilet schedule has to be made for the child. By toilet schedule, I mean that the child has to be taken to the bathroom at regular time periods. In the initial few days, the child may be required to be taken to the toilet every 15 minutes or so. We have to do this so that there is a minimum chance that the child will pass urine outside the bathroom. So every 15 minutes or so, you can go to the child and tell the child, potty time, in an excited manner, and make the child repeat the word potty. Now, don't be very rigid that the child has to correctly pronounce the word potty. Even if the child makes an attempt or an approximation of that sound, reinforce that utterance and immediately take the child to the bathroom. Once in the bathroom, help the child take off his underpant and sit on the potty. Now, it will be a good idea not to teach the child to completely undress, but just to remove the underpants up to the ankle. Because some children may develop the habit of completely undressing while passing urine, and this habit may be difficult to reverse. Now, once the child is sitting on the potty and they happen to pass urine or have a bowel movement, you must reinforce it with your full vigor. You may excitedly say, good pee pee or good poo poo. You may clap, you may hug the child, give a sticker on the child's hand, or give the child a toffee. Remember, if the reinforcement is strong enough and is given immediately, it will increase the likelihood of the child urinating or defecating in the bathroom the next time too. Another drill which you will have to make the child do is called check dry pants. Here you tell the child, check dry pants, and then you prompt the child's hand and make them feel the outside of their underwear so they know whether it is wet or dry. Now, this check dry pant routine in the initial few days should be done every 15 minutes or so. Over a period of days or weeks, as the duration of the dry period increases, you can increase the check dry pant period to 30 minutes, to an hour, 1.5 hours, and so on. Remember, every time the child is checking for dry pants and his pants are dry, this is an opportunity for you to reward the child again and reinforce having dry pants. So once you have said, check dry pants, and the child checks his pants and they are dry, you very excitedly should say, good dry pants, clap, and give the child his favorite reinforcer. Additionally, frequently checking for dry pants will allow you to detect any accidents and take remedial action. If the child has an accident and has wet his diapers or underpants, then you can utilize something called as overcorrection or positive practice. What it means is that in a calm but in a matter of fact way, you help the child undress, clean up, wear a fresh set of underpants, and then Take him to the place of accident and point to the wet pants and sternly say, "Bad wet pants." And then you make him walk quickly to the bathroom and sit on the potty. Repeat it 5 to 10 times in a row. But this method may not be very practical in certain scenarios. Like, for example, in school, where the child may perceive it to be very stigmatizing if he is made to walk from the place of accident to the toilet multiple times. Also, this practice is not useful if the child is not cooperative, or if the child is combative, or if the child is large in size. Now moving on to bowel training. Many children who have developed daytime bladder training may spontaneously develop bowel movements too when they sit down to urinate. And whenever it happens, do remember to reinforce it very positively. The techniques that I have discussed in daytime bladder training are also applicable for bowel training. So do use them. But if a child over a period of months continue not to develop bowel training, even though he has fully developed daytime bladder training, then one of the reasons could be that your reinforcers have lost their motivating powers. Either the child has become bored of them, or they are just not interesting enough. Hence, you must relook at the reinforcers every couple of days or weeks whenever you see the response of the child dipping. Once the child has developed daytime bowel and bladder training, you can now move on to nighttime training of the bowel and bladder. In many cases, the child will generally train themselves and will start waking up dry in the morning. Now, if you are one of those lucky parents, then if your child is waking up dry 5 to 7 mornings continuously, then allow the child to sleep without a diaper at night. There may be some occasional accidents when the child is sleeping, so you may take some precautionary steps like putting a plastic sheet under your bed sheet. But getting rid of the diapers as soon as possible is extremely important step. But if the child has not developed nighttime bladder control on his own, then what we can do is start by limiting the liquid consumption in the evening or night time. You should encourage the child to have lots of liquid in the afternoon and minimal liquid since evening. The child should evacuate his bowel and bladder once before hitting the bed finally. Not uncommonly, passing urine at night while sleeping is secondary to constipation. So please note if your child is having irregular bowel habits. If it is so, try and get it corrected. Generally, adding a lot of roughage and fiber and fluid to the diet takes care of constipation. But sometimes a medical consultation may be required. It will be very helpful if a child has regular sleeping and wake up time. But unfortunately, children who have neurodevelopmental disorders like autism occasionally have difficulty in falling asleep or maintaining sleep. So, if the child is waking up at night, you must make sure that you take the child to the toilet so that they can sit on the potty and have a chance to pass urine. Even in children who do not wake up at night but are regularly passing urine at night, see if you can discern a pattern. For example, maybe you have noticed after 10 days of meticulous record keeping that the child passes urine in bed 3 to 4 hours after going to sleep. Now, if you have caught on to this pattern, what you can do is you pick up the child, take the child to the bathroom, make him or her pass urine and get them back to bed. Some children are lucky that they don't wake up during this entire process and don't even realize that they have evacuated their bladder at night. Whatever you may do, one thing you must avoid is never shame the child or be angry at the child. Because during sleep, they don't have control over their bladder and it will only affect their self confidence and may give rise to serious anxiety issues later on in life. But if despite everything, the nighttime bladder control continues to be a problem, then we must seek a consultation with the pediatrician. Once a child has developed control over his bowel and bladder, they may still be dependent on the bathroom schedule which you have made for them and also dependent on the prompt which you have been using for so long. If that is the case, then toilet training is not complete because our aim is that the child should initiate his own use of toilet and that should happen without any scheduling and without any dependency on prompts. We can achieve this by gradually fading out the prompts and getting the child out of the toilet schedule that we had made for him. For example, if the child is consistently remaining dry for a period of 2 hours or so, you may increase the toilet scheduling to 2.5 hours and later on you may keep on increasing to 3 hours, 3.5 hours and so on. Gradually, you keep on reducing the frequency of the scheduled bathroom visits. Similarly, you will have to fade out the prompts too. For example, initially you were prompting the child by saying, "Potty time." Now, once the child has gained adequate bowel and bladder control, after saying potty time and the child repeating the word potty, as you are walking to the bathroom, you may just stop the child 2-3 times on the way and ask in a playful and cheerful manner, "Where are we going?" If the child does not answer immediately, prompt the child to say potty. "What will we do?" Ask him. And then wait for some time for the child to answer. If the child does not answer, you say the word potty. By doing this, what we are doing is we are telling the child how to use the word potty as a request or a command for going to bathroom. I have spoken in great details in my earlier videos about what is command or request. But now, what to do if the child continues to have toileting accidents even after the toilet training is complete? Now, if it is a one-off thing, then please do not worry. It can happen to any child. But if it is happening regularly and it is happening after the child has been trained adequately and has developed control over his bowel and bladder, then we need to rule out certain things. First, look at common things like, is the child eating anything different? Or is he eating more than usual? Or is he eating a lot of junk food? Then look whether there has been some change in his medication. Or maybe you have added some supplements in his diet. Or it is just simply that the child has developed a stomach upset or has a urinary infection. These things can be easily taken care of. Also, if you do not find any of these things, try and look for a pattern. What I mean to say is, try and see whether these accidents happen around one particular time of the day or any one particular activity. If that is the case, it is comparatively easy to manage as we can just put the child back on toileting schedules for those part of the day. For example, if you have noticed a pattern that the child is having toileting accidents when the child is playing in the swimming pool. Now you have noticed this pattern. Now you have to go around solving it. So what should you do? First, take some precaution. Let the child visit the toilet before he enters the pool. When he enters the pool, make him wear a waterproof diaper. Take him out of the pool in a toilet schedule after every 10 minutes or so. Then make him sit on the toilet and then again enter the pool. Over a period of time, as his dry period increases, you increase the toileting schedule and gradually you stop it. All these sort of problems can be managed very easily by just application of mind and little bit of tinkering of the knowledge which you have gained over this video. I hope my aim of teaching you parents and caregivers about how to toilet train your children who have autism or neurodevelopmental disorder is successful.